and allows for the Medicaid to end for people who are not still eligible. Okay, so it's separating it, letting it not be tied to the same thing. So what's really critical about this is a lot of people with Medicaid, sometimes they move, sometimes they don't update information, sometimes they change email, how these things happen. And it's very important that this information gets to the people who need it. Okay. So along with that, there's a lot of data reporting that's being required by the state. There's a lot of record keeping, including eligibility renewals initiated, all the way down to how many people are just renewed by what they call ex parte or passive renewals. Even, down to call center volumes and stuff like this. All of this information has to be recorded and monitored in order to ensure that the states are following the correct procedures and that people are given the opportunity to maintain coverage. And there are financial penalties to the state if they do not report all of the information that needs to be reported. So there's a lot of background stuff that goes with this as well. So what is the unwinding? The Medicaid unwinding actually refers to the process of reviewing the eligibility for the Medicaid enrollees. Start this month. It's actually already started. And the first terminations will begin next month. By April 30th, people will start coming off. Now, a lot of this is going to be done by what they call ex parte or passive renewals.
You're cutting up a little bit.
That means basically, I mean, so with that, they'll be sending out notifications and we'll start the renewal process. Okay. A lot of the information is in this slide, so if I do, bear with me. I'm sorry. I am on Wi-Fi, so. Okay, so 1 million people will not lose their Medicaid on April 1st. It's not everybody's going to just lose it. There's going to be tiered renewals. The first groups will start receiving notices that haven't used their Medicaid in the last year. These are people that have it, they didn't know they had it, they forgot they had it, if they will, they didn't know they still had continuous coverage. Children who have complex medical issues will be some of the last to go up for renewals. In order to meet all of this demand, there's an increasing call center with dedicated staff for this. They've had lots and lots of stakeholder meetings. They've sent out postcards to recipients to ensure that they have updated information. And the states must make a good faith effort to locate enrollees. Again, they need the up-to-date contact information. They're also using information from the National Change of Address database from the Postal Service. They also are not allowed to disenroll anybody on the basis of returned mail until they have made an intense good faith effort at locating them. This includes even case managers texting or emailing directly to the consumer. And state of Florida is one of the only states that DCF works with their EBT providers to actually update information as well. So they're working with the EBT providers. They're working with managed care providers. They're conducting stakeholder meetings. They're reaching out in a number of different ways. Those receiving SNAP benefits, and for renewal time, they apply or update their EBT or SNAP benefits. And that whole passive renewal process that can be done is being done with many cases, people not even having to do a active update on their information. They're looking at historical pay information, historical information that they can, wage information to be able to continue those updates. Okay. Not everybody will be eligible. Some people will come off, some people will need to look at other sources, and we'll get into that. But right now, we want to make sure that people can get their coverage if they are still eligible and maintain it and get the notifications that they need in order to continue that. If they cannot, if DCF cannot determine whether or not they can be automatically renewed or the ex parte or passive renewals, then they will be sending out letters or notices and asking consumers to respond. And then they will get supplemental letters. They won't just be cut off. But the renewal notices that they're going to get are going to be these yellow striped envelopes. Okay, they're going to get that information, and that's what they need to look for to update and to reapply and have a new redetermination created. Okay. One of the things we really need to do, anybody who knows anybody with Medicaid or works with anybody with Medicaid, they need to get that word out. They need to help consumers update their information as needed. Watch for that yellow stripe envelope. Have them encourage people who do have Medicaid and do need to respond to do it timely to prevent a lapse in coverage. And if they notice any kind of systemic issues, bring that to DCF's attention. What consumers don't want to do, we don't want to encourage people to apply early. They need to wait until they do get the redetermination notice, because they'll flood the call centers, and they will just confuse everybody and create lots and lots of confusion. So some of the effects of the Medicaid unwinding. There is an expectation that all of these 5.5 million Medicaid enrollees that will be completed within a year. It has to be completed by April of 2024. There are approximately 900,000 cases in which there's estimated to be at least one or more member of the household that is no longer eligible. Many of these will be kids, 21 through 60, or adults, 21 through 60. Few of them will be kids between the ages of 5 and 16. Really, these are the ones that should not have been kept on Medicaid because they do not financially, they're not financially eligible, or they aged out of the system as 21-year-olds. Many of those would have aged out of the system. And the first terminations, again, will happen at the end of April. So a little over 30 days from now. 7.9% are expected to lose Medicaid coverage who are still eligible. And the reason for this is people just won't respond. And they need to respond to those letters in an active and timely manner. Okay, they'll just drop off. They won't respond until the time they actually get an emergency room visit that they need to have dealt with or something like that. We don't want that to happen. So children and young adults will be impacted at a little bit higher rate because, again, those young adults moving off of Medicaid who would typically have aged out is expected to slightly larger percentage of those, about 1/3 of those predicted to lose coverage are expected to be Latino, 15% Black, and again, 21% are kids of people who had increased or changed in income. Okay. Medicaid winding, these people, 9.5% are expected to no longer be eligible, and they do have other options and they will need to transition to another option, another source of coverage. This is kind of a little idea of what could potentially happen. For instance, you have a pregnant woman who meets the Medicaid requirements, so income and all of that. She'll just continue on with pregnancy Medicaid. You have a family that's eligible with children. You can see the process. They can go through all the steps. They might get that notice in the mail, respond to the notice, provide the information, and they're still eligible for Medicaid. You have the family that becomes ineligible with children under 18, and you've got two kind of paths that they can go with. The first one is they're immediately ineligible for Medicaid, and they get health care through like ACA or other service, and they continue with their health care that way. The other automatic referral, they're going to go to healthy kids. Those are those 5 to 16-year-olds, 5 to 18-year-olds that are going to be financially too much income. They're going to send that information over to healthy kids. They're going to contact them. They're going to get a couple of options, maybe a $15 or $20 copay, or they're going to not qualify for that and have to go into an ACA plan or other qualifying health coverage. Okay. All right. Almost a third of those will probably be able to qualify for advanced premium tax credits through the marketplace. Some of those will be as low as a zero premium policy through the marketplace. A lot of them will be qualified for cost sharing reductions. And one of the things we also want to point out is that they have fixed the family glitch, which I'm going to talk about a little bit later, but that's a critical thing as well for families that have job-based coverage. Okay. And there are other options, of course, out there, but we really want people to have those good insurance where they get the coverage that they need. Okay. So a little bit about eligibility. So Medicaid eligibility, which is what I'm going to focus on first. To be eligible for Florida Medicaid, you must be a resident of the state of Florida. You must be a U.S. citizen, a national permanent resident, or legal alien. If you're an adult, you have to have been in the United States for 5 years. You must need insurance assistance. You shouldn't have another source of it. And you must have very low to no income. Very low to no income. This is how low those income needs to be. It's a very, very, very reduced amount for a single person household. The gray line there at the beginning is the federal poverty level. For adults, parents, caretakers, children 19 and 20, that's $180 a month in income. There's what they call a standard disregard, which is an amount that is you can add to that. So $289 a month, and you have too much income for Medicaid. Okay, the teal color there is for pregnant women. The orange for infants less than 1 year old. Orange, kind of the dark gold color is children ages 1 through 5. The yellow is children 6 through 18. So if you get over $2,000 a month, basically a child is not going to be qualified for Medicaid. Okay. And there's some standard disregards and stuff like that, but still it's a very low amount for income. So many of these people, again, will have had a job by now, will have had changes to income, and will now not be eligible for Medicaid coverage. We do have different types. I kind of touched on the last screen. There's basically different types: pregnancy, children up to 21, caregivers of children under 18, foster children up to age 25, non-citizens with medical emergencies and coverage for the aged or blind. And there's also what is called medically needy or share of cost insurance. And that's basically where the people have too much income or assets to qualify for a full Medicaid, if you will, and they are then limited to what is needed for their medical situation. Sorry, this light is a little bright. I'm going to turn that down a little bit. Okay. One of the things state of Florida did do with the Consolidated Appropriations Act actually was allowed to begin doing this in 2021. It extended postpartum coverage to 12 months. This was a fabulous thing for pregnant women. And it was made permanent with that Consolidation Act, Appropriations Act in 2023. So that was a really, 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 really wonderful thing for our pregnant mamas. Okay. And if you're no longer eligible for Medicaid, what now? Where do you go from here? Basically, there's like 5 different directions to go to. The first with children would be kid care. We also have that medically needy Medicaid program with the share of costs that I was mentioning before. We have the federally subsidized health programs or ACA coverage. You have commercial coverage either through a private insurance company or through an employer-based or job-based coverage. And you could always go to a federally qualified health center, which work on sliding scales. So a little bit about kid care and kid care eligibility, or CHIP. This also is referred to as CHIP. Florida Kid Care is for children, obviously not adults. They have to be under age 19. There are income eligibility requirements to have subsidized health care through CHIP, but through kid care. But if they do not meet the income limits, there is still able to get a full cost kid care. They do have to be U.S. citizens or qualified non-citizens. I would like to also mention children can get Medicaid even if they're an immigrant, immediate immigrant. They do not have a 5-year waiting period. That's only for adults. I mentioned it before, but I didn't really point out that that was really tied to adults and not children. Okay, and they cannot be in a public institution. And I did add in the charts, the guidelines for kid care and the cost of the premium. If they're under 133% of the FPL, they qualify for that Medicaid. If they're over that, between 133% and 200% of the federal poverty level, they qualify for those low $15 to $20 monthly premiums. So over 200% of the federal poverty level, they're looking at a full pay for Florida Healthy Kids, which is $2 something a month. It's just under $250 a month, including dental. Okay. And $259.50 with dental. It's right there for the full pay. And this is just that overlapping income based on age and all of that. So you can just see that. Okay, and the Children's Health Insurance Program did get additional funding as well that was extended for the next 2 years. And there's also Medicaid is a 6-month renewal process. For CHIP or kid care, it's a 12-month process. And actually children have been extended to a 12 months in Medicaid, I'm sorry, and CHIP. Okay, for those who don't qualify for that, we're looking at maybe the ACA Marketplace is a good place. Okay, the Marketplace is a private insurance plans, but they do have qualified savings such as advanced premium tax credits or cost sharing reductions. They are based on your household size and income. If you don't qualify for savings, you can still purchase plans at full cost. All the plans do cover the minimal essential health benefits, such as pre-existing conditions and preventive care. The only problem is generally you can only plan for them in open enrollment unless you qualify for a special enrollment period. In this case, also losing Medicaid will qualify you for a special enrollment period. Okay, like any other life change, like getting married or having a baby also does. So to be eligible to enroll in healthcare through the Marketplace, you must live in the United States. You must be a U.S. citizen or a lawfully present alien. That means somebody who came in with legal status. You can't be incarcerated because if you're in jail, you can't use insurance, and you must have at least 100% of the federal poverty level. Depending on your income, you may be eligible for additional cost share reductions as well as the tax credits, which I'm going to go over just a little bit. The premium tax credits are a monthly amount. This goes to help pay your monthly premium. If you're not real familiar with insurance, you have a lot of different things, and I'm going to kind of hit on a couple of those. You have premiums. That's the amount you pay month to month to ensure that your insurance continues. You have deductibles. That's the amount you have to pay before your insurance actually kicks in and pays for anything else. You have maximum out of pockets. This is once, I don't know if I put this slide in here, but once you actually, no, it's not, it's in the other presentation. Once you reach a certain point, you paid your deductible. Now you're paying a percentage, and the insurance company is paying a percentage of your health care. Like say 70% is being paid by the insurance company, you're paying 30%. Once you reach a certain point, you reach your maximum out of pocket, the insurance company then pays everything. Now, all of that is at the same time you're paying your premiums every month. You also can have co-payments and co-insurance. That's like that $30 you pay every time you go to the doctor. That's a co-pay. Co-insurances are like co-pays, but they're a percentage instead of a fixed amount. Okay, so that kind of a little idea of some of these things that are going to be referred to in this slide. So the advanced premium tax credit is a monthly credit that helps you pay for the monthly premium. You can use all or a portion of this depending on how well you figure your income, or you feel comfortable that you feel compared to your income. You get reconciled on your tax return with this using the 1090A form. If you miscalculate your income, you could have to pay some back, or you could get an additional refund if you would have been eligible for a greater credit. You do not have to use, when you go through all of the information on the ACA, you don't have to use all of this tax credit. You can use just a portion of it, or you can use all of it, or you can use none of it. And you could just say, okay, I'm going to get this tax credit and I'm going to pay my full amount month to month, and I am going to get a large refund. Or you can use a part of that credit and reduce your monthly amount, or you can use all of that credit and reduce your monthly amount. However, if you did miscalculate your income, you could have to pay some back if you got too much. Or if you had, a big windfall of money, you won the lottery or something like that, then you're going to need to pay it back. All right, cost share reductions reduce your out-of-pocket costs when you're using your insurance. It lowers your deductible. So that means your insurance plan starts paying your share of your medical costs sooner. So if, say, you have $1,000 deductible, it could lower your deductible down to $0 or $100 or $500 rather than $1,000. It can lower your co-payments and co-insurance. These are the payments you make every time you see or have a doctor visit or you get care. Maybe it's $100 on this plan normally, but because you got cost sharing reductions, your $100 copay for your doctor is now down to 30 or 25 or 15 or even 0, depending on your income level. And it can lower your out-of-pocket maximum. So the out-of-pocket maximums can go up to about $9,000 a person on the return. So $9,000 for you, and then potentially $9,000 for your spouse, or so your family total is double what it is for a single individual. And if you have a large amount of medical expenses, that's where you're going to be looking at getting to that maximum out of pocket. It's not something you're going to have to pay all the time. It's going to be one time. And once you hit that, the insurance is going to pay everything. Okay, other than your premium. You still have to pay your premium. Okay. There are percentages involved again up to the income level. The expected premium contribution is based on your income. The higher your income, the higher expectation that you can put into your premium. So that's what that percentage is based on. That is not, it's given to us. It's a fixed amount set by law. Okay. And those cost share reductions, 91,000. I think I said 9,000, 9,100 is your maximum out of pockets on most plans. And then it's double that for family. Okay. Again, reduces those immediate costs if you need them. Okay, we do have, again, like I said, the special enrollment period for clients coming off of Medicaid. They actually are going to qualify for a special enrollment period if they have lost Medicaid or CHIP coverage anytime between March of this year and July 31st of next year. And you'll have 60 days once your coverage is terminated in order to start a new plan, to give you time to schedule a plan and get it going. Also, low-income consumers between 100 and 150% of the federal poverty level are eligible for a special enrollment period as well. This means a family of four with income between $27,750 to $41,625 would actually be eligible for a special enrollment period at any time. And of course, then there are other options that people may be able to do. They may be able to now enroll in employer-based insurance. Again, this is where you might encounter the family glitch. It could be purchase private insurance. That's very pricey. Most people can't afford that. So what the family glitch is, I'm going to go over this really, really quickly. The family glitch is actually a gap in eligibility for subsidized marketplace coverage. What happens is when people go to add their families onto the insurance, it was so costly they couldn't afford to do it. It was ridiculous because of usually your employer pays a portion and then you pay a portion. With your family, the employer doesn't pay a portion, you pay the full cost. And depending on the insurance, it can be very, very, very costly. So what they've come out with is a reinterpretation of a rule. The affordability used to be strictly based on just the employee-only coverage for everybody in the household. So you might be insuring 5 people in the household and only be able to really afford to cover one. So what they're doing now is they are actually looking at the cost for the employee-only coverage and the family coverage, whether or not it is considered affordable. If it's in excess of 9.12% of the annual household income, I think that figure might be low. I think it's a little higher than that. Then it is considered unaffordable. Okay, so what they've done is they've rewritten the rule, the interpretation of the rule. So there is separate affordability tests, one for strictly the employee and one for other family members, based on the employee's contribution towards family coverage. Okay. The other option that people will have for coverage is to go to federally qualified health centers. They work on a sliding scale based on income. There are, multiple locations around town. These are agape clinics in Sulzbacher's Shelter and Sulzbacher's Pediatric Village. They do give you the coverage. However, they are not, they're working with time. They're very limited as far as there's only so many dollars to cover everybody. So, and it is on a sliding scale. Additional help, there are free clinics like Volunteers in Medicine, Muslim American Social Services, the Wakely Clinic in Clay County. They can provide primary care services. The one problem with them is that they do not provide emergency services, which means if, say, somebody falls and breaks a leg, they could be on the hook for the entire cost of the emergency room visit if they have no other coverage. So how a navigator can help, to me. We can actually, we're trained and certified, registered with the state of Florida, just like insurance people are trained and registered with the state. However, unlike insurance agents, we provide free and unbiased help to people for healthcare coverage. We don't limit ourselves just to one company. We work with multiple companies. We can provide education. We can help you determine which of your employer's 10 different options is the best one for you. We look at a lot of different things. It's not just to get insurance product. It's to get one that fits you and your life and to help you get what you need. We work for you, not for the insurance company. And I actually think I kind of flew over a couple of slides there. I apologize. And we do virtual and phone appointments and can work with a variety of people. Okay, that was my contact information on the last slide. So I am open for questions, or if anybody has any questions.
I do.
Sure, go ahead.
Hi, thank you so much. My name is Sol Winter, and two things. I am a certified community health worker. Am also, I hold a license as an insurance agent, but I use that license in my role as marketing for an insurance company. I do take our job very serious. So what we do, and I speak for myself, we educate. I was previously a choice counselor when Medicaid managed care just, was launched in 2007. So I do know about educating the person for them to make the best choice. And that's what I continue to do, and I will do for the rest of my life. I say that just because sometimes, we cannot group everybody into one basket. And I like to make it clear that there are great agents out there that are educating regardless of which health plan they represent. With that said now, I am also a non-English speaker or a speaker of a second language. So I would like to ask, based on the information that was sent out today, that video or, the MP4, which is a very good PSA, if that is also available in any other language. In addition to that, I have heard of everybody doing their part, but I ask, what role is the media playing in all this? Most individuals that are eligible for Medicaid, and I have worked for DCF, so I know the rule per se. Those who have been on Medicaid, they know every year they're certified. I know this situation with the unwinding mostly apply for families who have never in their life be part of the system, or just because of the situation they became part of the system, like many of us. So it's not those people, it's all of us. And that information mostly is to educate those families. What role is the media, the local media, playing in this? What conversation is the Health Planning Council having with them, in addition to the other organizations? Because every day as a servant to the community, we attend different meetings and we do get the information and we do share the different agencies, but most individuals will tune into a radio, will tune into their TV, and I haven't seen anything locally that, will kind of guide us or guide them to say, hey, this is important. The other thing that I wanted to point out is, pardon me, we are trying not for people to panic, but at the same time, and we're telling them they need to make sure that they look into, the letters that are going to come, XYZ. We don't want them to call before. We don't want them to reapply before, but at the same time, we're telling them this is important. You have to make sure that you don't lose your coverage. So I think at some point, we are the one who's also making a lot of, bringing a lot of anxiety to the normal person who may not have, although we're trying with our best effort to bring the attention to the community. But I think just the different rhetoric that I hear on the different meetings is, we need them to apply. We don't want them to lose their coverage, which we know most of them may not lose it. The reason is because those individuals working prior to the COVID, they will have never qualified. Those who have always been on Medicaid based on their income, they will continue to qualify, and those are the ex parte. So it's trying to focus when we are having this conversation with the community to let them know, if you have already been part of, being a recipient, and do it with dignity, because at some point, every one of us have or will experience the need to use our tax paying or tax funded programs, which is Medicaid, Medicare. So it's, maybe right now we don't because we're employed, we have employers in, coverage. But if we become disabled, if we lose our employment, that's what we fund these programs for. So I believe the focus should be to kind of just, try and make sure that the information goes out specifically for the individuals who may have never prior to COVID apply for Medicaid. They have received, and they did not know that every year by default, individuals who are recipients of Medicaid need to recertify. And because no one had to do it for the last 3 years, it becomes like it's normal. So it's just kind of educating and letting them know every year, anyone who has been a recipient of Medicaid needs to recertify. Due to this situation, most individuals for the last 3 years did not have to, but now the state is going through every case and they're going to be, reviewing every one of the applications. So just make sure if you have moved, just check your mail, update your information. The way we present information can lessen the stress that people are already experiencing, and especially when they're new to these type of government programs that they would have never applied if COVID did not hit this world. So it wasn't really like a question, but in some way it's a question, suggestion, and everything. But my main thing here is to know, other than that MP4 that you sent out today, or somebody from the Health Planning Council in English, is there, especially in Jacksonville. And I know we have the language line, but there is nothing more valuable than someone having that information in our own language. And we have many non-English speakers that can certainly provide that translation and provide it in the language based on the culture and the awareness. So if there is one in Spanish, I would greatly appreciate it. If there is one in Arabic, I will greatly appreciate it. Whatever is out there, other than the flyer that I have in Spanish, English, and Creole, I would greatly appreciate some video. Thank you.
I'm glad to see that that it's being seen. We are using social media, as you saw the MP4. I thank you for being a responsible agent of insurance, because we do see both sides of that. And I'm glad that there are people who are very ethical and are still striving to do the right thing for the client. So thank you for that. I am not sure about, I thought there was a Spanish version of that video. I am not 100% sure. I do not know if there are any other languages at this time. I believe there is a Spanish one though. Do you know, Jen?
Yeah, there is a Spanish version of a flyer. If you know of other means of translating it to different languages, we would certainly appreciate that help. We're kind of a small group, and this is a monument. So although we're not trying to panic anybody, as you mentioned, that certainly is not the objective, but we do believe that the system is going to be flooded, and it's from people that don't normally pay attention when they really should. I know my son gets SSI and gets Medicaid. I get a ton of stuff in the mail. So they're trying with those envelopes. Kind of, you flip over to that one, that looking for the yellow stripe. That was one of their objectives, is to just have something to jump out to people saying, hey, this is something you want to pay attention to. Yes, most people that are on continuous Medicaid and qualify and will qualify, they know already that they're going to have to go through that. Those aren't the people we're trying to reach. It's the other ones that are going to panic and overwhelm the system. We're trying to avoid that, if that makes any sense. But any assistance that you might be able to give to all of us, this is a group effort that we're trying to get this word out, because it's a very short period of time. It's going to go quick. And we have how many navigators, Glenda?
11.
11 navigators in our program, trying to work towards this goal. So, that it's all hands on deck.
And I will add, and I appreciate you sharing the information. Certainly, I know that most of you, because as I said, I attend these different meetings, you also participate in meetings where you have the Refugee Task Force, you have the Department of Health that has its own semi-task force. So this is where, you know, and I understand with due respect, unless the shoes fit the person, that's the only way most of us will advocate. So I am advocating because I am a non-English speaker. And because it is important to us having the Jacksonville being one of the cities that has the most languages, you know, within the counties, other than Miami that may have 3 or 4 or 5, but Jacksonville is the hub. You have Lutheran Social Services, which you also, you know, have these conversations with them. So it is maybe what I'm trying to say here, whenever you're having these conversations, trying to service the community that we have, which is very diverse, and it will continue to be more diverse. You have Polish here, you have Russians here, and they are here, they're working with the different agencies. They are professionals sitting in leadership in on the Department of Health. They're also doing it, you know, with these different entities. They have their own businesses. Reach out and ask them, hey, can you do that, you know, to serve your community? Put it back where, if we really want to bring it home, where most of the individuals who may or may not know of this, then, you know, it's also a collaboration, because by we starting this now, it will become something when there is a situation. It's not just one language, it's not just 2 languages, but it could be more. And I will really appreciate whenever, and I know, as I said, unless you walk that walk, you will not think of it by default. But whenever you're sharing information, if there is anything that you consider in another language other than English, it would be greatly appreciative if it could be shared at the same time, because there are professionals here, and I consider myself one, that we think of the needs of others. And, you know, I do have to reach out back to the different leading agencies and say, hey, do you have this in English, or do you have it, pardon me, in Spanish or Creole or any other language? Miami is by default, it will be English, Spanish, and Creole. So Jacksonville needs to get to that point where English. Thank you.
Yeah, I agree with you. It's just, as I said, this is an all hands on deck situation. If you have translators, feel free to take any of our flyers and translate and get the word out. I totally agree with you also, by the way, on the media. The media needs to be involved. Maybe some of the larger organizations have their ear more than our little organization. Everybody needs to help to get the word out. So, you know, the more the merrier. And I will, by the way, I'm trying to find right now that Spanish translation, so I could at least get that one to you.
Thank you.
Thank you. Does anyone have any other questions? Okay, well, thank you all for joining us. That presentation was a lot to unpack, but it's definitely an important topic that we need to, like you said, educate as many people as we can about. I will get with the team to talk about maybe creating a Spanish video, because I am a native Spanish speaker. So that's something that I could possibly do soon. Thank you for joining us. We'll be sharing this video on YouTube. If you missed anything, you can go back and watch it.
And Marianne, I just wanted to thank our speakers on behalf of the Jacksonville Urban League and the Center for Advocacy and Social Justice. We learned a lot, and keep up the good work, helping those people get reconnected if they can.
Thank you.
Have a great evening, everyone.
Y'all take a night.
Thanks.